Hydrocephalus is directly correlated to a major traumatic brain injury. What are the risk factors for a much higher incidence?
Hydrocephalus, unfortunately, is a possible complication of the compressive craniectomy and for severe brain trauma. The risks are not uniform, but one of the risks is, of course, previous factors, and in second instance, the development of some specific related treatment. For example, if patients are submitted to the compressive craniectomy. But the severe brain injury is itself related and a higher complication, possible complication of hydrocephalus.
Does the compressive craniectomy lead to a better prognosis?
Still, this is a controversial topic still now, but in my experience and some tendency, some suggestion by the literature, is a life-saving procedure. So the compressive craniectomy, of course, when other treatment options fail, the compressive craniectomy is something to consider in depth, to seriously consider the compressive craniectomy. In my experience, is really a good procedure and a life-saving procedure. Of course, there is the dark side of the medal, and it could lead to a higher incidence of severe disability. You save the life, but the patient could be not to recover completely and still is disabled. But this is something that we are trying as scientific community, try to really identify the best patient selection for the compressive craniectomy, because the future goal is to save the life, but even the quality of life. So it would be the best to properly select the patient in order to save the life, but give as less as disability possible.
Could happen hydrocephalus also after a craniectomy?
As I said, it is possible. It is for sure related to the compressive craniectomy, but we still don't have a real evidence that that hydrocephalus is post-craniectomy, the compressive craniectomy, or is the natural evolution of a post-traumatic hydrocephalus. But for sure, the compressive craniectomy can provide a risk of development of hydrocephalus, yes. Hydrocephalus that even in patients that are in the rehabilitation institution that are going good, that is a good recovery, suddenly decrease in recovery. And one of the major causes of this worsening of recovery is the hydrocephalus that must be promptly treated.
Is post-traumatic HH consequences in a delay of cranioplasty?
Could be, because headache and but even some other much more evident sign, for example hemiparesis, can improve or in most of the cases disappear after the bone flap repositioning. So cranioplasty can restore the real environment for the brain, because the brain is inside a closed system. With the compressive craniectomy, we open the system, so it's a sort of open box, and this can interfere with the cerebral blood flow, with the CSF dynamics, so developing hydrocephalus or some neurological deficit. So the bone flap repositioning, the cranioplasty, is absolutely a procedure that have to be scheduled as soon as possible and with the best material available for that patient. But for sure, most of the signs, most of the symptoms that the patient complain before cranioplasty, in most of the cases deep improve, or in some cases disappeared. So my answer is yes.